Hi, I'm Mike Gogarty. I'm the Director of Wellbeing, Public Health and Communities at Essex County Council. We're working very closely with police, both in terms of the Essex-wide SCG, but also we've got members of the police on our Health Protection Board. I think it's really, really important that people do self-isolate if they become unwell and get tested as well. Nationally, the sense at the moment is probably about 30% of people who are getting symptoms are actually testing. So we really need to increase that number if we are going to stop an increase in cases as time goes on. So it's absolutely critical. The difficulty is that the main group are those who don't go for testing at all. So we don't know if they got symptoms. In a sense, trying to chase down those who have already had a test, you're chasing the good ones because they're the ones who've actually had a test in the first place. So it is actually very difficult to detect those people who are symptomatic and are simply ignoring the fact and carrying on the daily business. So it's very difficult to do so. Where we have been working closely with environmental health officers, police, is in terms of making sure that social distancing happens in hospitality. So there are a number of pubs, a number of areas where the public meet where that hasn't been put in place. And we have new powers under the Coronavirus Action Act. And also the local authorities have power at environmental health officer levels and police to enforce that. And we're working very, very closely together to try and make that happen where that's important. But actually the crucial thing is no matter what the police do, no matter what I do, unless people get tested, unless people self-isolate when they have symptoms, we are never going to defeat this. And we only know those people who are tested. So again, the messages are the same as they are now, but will be even more important as winter draws on, because as winter comes on, we will see more cases because the coronavirus will get more active as winter approaches, because it does, because people will have to meet indoors. People won't have the opportunity to meet in gardens like they do now, unless they're kind of very well wrapped up. And of course, the schools are back now, so the opportunities for spread are increased. So it's really much, much more of the same. Please keep social distancing as much as you can, more than 2 meters, or 2 meters if you can, because 2 meters is much more effective than closer distances. If you keep away more than 2 meters from people, you should be safe. You shouldn't have to self-isolate. You shouldn't get the condition. Wash your hands as much as possible in case you touch surfaces that have got the virus on them. If you wash them off, then you won't transfer it to your mouth or to your nose. And absolutely, if you get any symptoms, please self-isolate straight away and get a test straight away. So basically it's the same messages. If you've got older, frailer relatives, you may want to think about making sure that they're okay, that you can get shopping for them, because as cases get higher, it may become less advisable for them to sort of to go out and shop themselves. So help frailer people, older people, people at risk from having to get into environments where they might contract and maybe in contact with the disease more. Well, first of all, it's your decision whether you go in the shop or not. And certainly you may consider taking your custom elsewhere, frankly. But also if you contact local environmental health officers at the local district or borough, I'm sure they'll be very interested to hear about it. And I'm actually very keen that members of the public, where they see these breaches, that they do report them, because that's the only way that we're really going to know what's going on out there. And we will take them very seriously, and we will act on them, and we will get environmental health officers to visit the place and to take appropriate action as required. We can fundamentally close places down now under the Coronavirus Action Act if we have to. The actual test, track and trace, we would look back 2 days. So people who've been in contact with you for 2 days before you have symptoms, we would regard them as contacts as well. So in terms of that, it goes back 2 days. However, increasingly, as we're trying to define what's going on, find out why we're getting these cases across Essex, we're also contacting people kind of separate from the tester and trace service to find out what exposures they might have had over the preceding 2 weeks. So where somebody has got the virus, we wouldn't just be looking at who their contacts are. We would also increasingly start to ask them questions to go back and say, well, where have you been in the last 2 weeks where you might have caught it from? So in terms of the actual test and trace to be a contact, it goes back 2 days before symptoms, but we will often ask people what's happened for a long time before that, because you want to find out where they've got it from, not just who they've given it to. All we can do is work with you, work with the people of Essex to try and improve these figures. Fundamentally, people have to realise that this condition is serious, that it is here, that is still increasing. That, as you say, and the evidence suggests, at the moment we would expect that nationally, we don't know the exact figures locally, around 40 people in every 100,000 get this condition in a week. But actually, we only know about 12 of 100,000 nationally in the week. So basically, it's only about a third, slightly more than a third, less than a third, are those that we're actually aware of and who are actually getting tested and isolating. And actually, we really need to increase that number. So people need to be comfortable to get tested, recognise the need to get tested, recognise the need to self-isolate. Some instances, there may be reasons why they don't want to do so. It may be that they don't want to lose their work, they may not get employed, they may be self-employed and lose money, but I think that can't be like 70-odd%. There'll be a small number in there. And if there are a small number who actually will financially be seriously compromised, then there may be ways we're looking at, possibly other ways we can support those people. But I think it's really important that people get tested as much as possible, that people come forward and have the tests and self-isolate. That's the only way in which we're going to sort of increase that number. There's not much we can do about it, because the only ones who know about it are the ones who come forward and do get tested.